Everyone, Dr. Massoud here with Monica, and Monica is in her last month of pregnancy with twins, and she came in a month ago to make sure she was able to deliver well without having C-section. A lot of people don't understand with chiropractic you can actually turn a baby. How does that happen? One of the reasons babies end up breech is because the mom is out of position and a certain area of her pelvis is stuck. So what's going to happen then is the baby's going to avoid that position. The mom has pain there. It's an uncomfortable area for the baby. The baby's connected to the mother, right? Neurologically, emotionally, biochemically, sharing everything. So the baby's not going to end up in that position where the mom is compromised. And ultimately, the baby sometimes ends up going breech to avoid that position. So in chiropractic, what we do is we work on the pelvis and we try to align the hips, because the way the hips come together in the back affects the birth canal, right? The birth canal in the front is really just a result of the pelvic positioning in the woman. So we want to keep the pelvis even so the birth canal in the front doesn't close. And that's what we've been working on with her. Aside from that, you've had a little bit of discomfort, I imagine, too.
Yes, becoming is able to maybe walk.
Being able to walk and work, right? You're still working
Yes.
it. So she's really going through it. Turning one baby is fairly routine. Turning two is a bit more magical. So we're working on keeping her head down. Another thing people don't understand is if you're not going into labor or if you're late with labor, we can induce labor with acupuncture, which is very safe and effective. I've had many women avoid C-sections over the years that the doctors wanted to schedule. And the thing with the induction is the Pitocin's an aggressive medication. The contractions come on exponentially harder throughout time. You're medicating throughout the pregnancy and throughout the delivery. And it's just something you'd rather avoid, right? If the doctor's going to tell you not to feed your kid broccoli, then they probably don't want you. Probably shouldn't be feeding it Pitocin either. But certain emergencies call for certain situations, and when medical intervention is needed, thank God it's there. But a lot of people don't understand these natural ways you can go about avoiding this. We've done this with hundreds of women. Monica, this is the first time I'm working with you. It's a pleasure to work with her, but hopefully we can get that baby head down within the next day or two. She was head down, right? About a week. So she's been very active, so I can imagine how she's going to be when she comes up.
Yeah, she's already mighty.
She's keeping you busy.
Yeah.
So we'll work with that. And then, when the doctor says it's okay, if induction is necessary, we hope to try acupuncture as long as she holds out long enough until then. But thank you for taking the time to have this conversation.
Thank you. It's been great.
I appreciate
really
it.
helpful.
Yeah, and obviously, along with all the pain and tension in the low back, there's neck pain, stress, right? So I imagine the adjustments of giving you relief with that as well. Yeah, so the headaches and everything. So we'll follow through, and then we'll see what type of follow-up care she needs post-delivery, and then nursing two babies is going to be fun too. So thanks, guys, for your time. Thank you.
Thank you.
Thank you so much.